Good morning, students. So, we are studying a new topic, healing and repair. So, what is injury? Injury to a tissue may result in cell death and tissue destruction. And healing, on the other hand, is a cell response to injury in an attempt to restore the normal structure and function. Healing involves two distinct processes, regeneration and repair. At times, both the processes take place simultaneously. When healing takes place by proliferation of parenchymal cells and results in complete restoration of the original tissue, it is known as regeneration. Healing by regeneration. When takes place by proliferation of parenchymal cells. Now, regeneration involves two processes. Firstly, there is proliferation of the original parenchymal cells from the margin of the injury, which migrates to cover the gap in the injury. Then these proliferated migrated cells, they undergo differentiation and maturation to reconstitute the original tissue. When healing takes place by proliferation of connective tissue, it results in fibrosis and scarring, and this is known as repair. Healing by proliferation of connective tissue is repair, and in regeneration there is proliferation of parenchymal cells. Cells are of three types depending on their capacity to divide: labile cells, stable cells, and permanent cells. Labile cells, they continue to multiply throughout life and undergo normal physiologic conditions. Labile cells are surface epithelial cells of epidermis, cells of alimentary tract, respiratory tract, urinary tract, vagina, cervix, uterine endometrium, hematopoietic cells of bone marrow, and cells of lymph node and spleen. Stable cells. These cells lose their ability to proliferate after adolescence, but they retain capacity to multiply in response to stimuli throughout the adult life. So they lose their ability to proliferate, but they retain capacity to multiply in response to stimuli. These are parenchymal cells of organs like liver, kidney, pancreas, adrenal, and thyroid. And mesenchymal cells like smooth muscle cells, fibroblast, vascular endothelial cells, bone, and cartilage. Permanent cells lose their ability to proliferate around the time of birth. These are neurons of nervous system, skeletal muscle, and cardiac muscle cells. Repair is the replacement of injured tissue by fibrous tissue, and two processes are involved in repair. First is granulation tissue formation and then contraction of the wounds. Repair response takes place by participation of mesenchymal cells, endothelial cells, macrophages, platelets, and parenchymal cells of the injured organs. Granulation tissue. The term granulation tissue derives its name from slightly granular and pink appearance of the tissue in the process of healing. Each granule of granulation tissue histologically corresponds to proliferation of new small blood vessels, which are slightly lifted on the surface by thin covering of fibroblasts and young collagen. So each granule corresponds to proliferation of new blood vessels, slightly lifted on the surface by thin covering of fibroblasts and young collagen. This microphotograph is depicting the granulation tissue formation. Here you are seeing ulceration of the normal epithelium, which is replaced by the granulation tissue. These are proliferation of small blood vessels, proliferation of fibroblasts, and inflammatory infiltrate. H&E stained section showing granulation tissue, blood vessels, inflammatory infiltrate, and fibroblasts. Now, wound healing. Healing of skin wounds. They provide a classical example of combination of regeneration and repair. Wound healing is accomplished in one of the following two ways. So there are two types of wound healings: healing by primary intention or first intention, and healing by second intention or secondary union. Healing by first intention or primary union, it is defined as healing of wound which has following characteristics: the wound which is clean and uninfected, the wound which is surgically incised, the wound without much loss of cells and tissues, and edges of wound are approximated by surgical suture. So primary union of skin wounds. As you are seeing, there is a incised wound. So it is a wound which is going to undergo healing by primary intention. So incised wound is filled with hemorrhage or blood. This is the suture tract, and there is inflammatory infiltrate. Then there occur proliferation of parenchymal cells. Spurs of epidermal cells migrate along the incised margins. So, proliferation of epidermal cells along the incised margin, and then formation of granulation tissue comprising of vessels, fibroblasts, and inflammatory cells, macrophages. After that, removal of suture at around 4th day results in scar formation. So you are seeing the wound is replaced by fibrosis or collagen deposition, which will lead to healing and scar formation. Healing by second intention or secondary union is defined as healing of wound having following characteristics: if the wound is open and with large tissue defect and it is infected, then secondary healing will occur. If there is extensive loss of cells and tissues in injury, and if the wound is not approximated by surgical sutures but it is left open, then wound will heal by second intention. If there is large defect, extensive cell and tissue loss, and surgical sutures are not required. So the basic events in secondary union are similar to primary union but differ in having a large tissue defect which has to be bridged. Hence the healing takes place from base upwards as well as from margins inwards. Healing by second intention is slow and results in large and ugly scar formation. So you are seeing there is large defect and loss of tissue. Large area of tissue is lost and suturing is not possible. So open wound and is filled with blood clot, and you are seeing inflammatory response. After that, epithelial spurs from the margins of the wound need to meet in the middle to cover the gap. So there is proliferation of the epithelial cells. It will cover the gap and separate the viable tissue from necrotic tissue and results in formation of scab. and there is formation of granulation tissue. So you are seeing granulation tissue in large areas. Then there is collagen scar formation. So coming to the differences between primary and secondary union of wounds, it is an important question for exam point of view. In primary union, the wound is clean, while it is unclean in secondary union. Infection is seen in secondary union. Margins are surgically clean in primary union, while they are irregular in secondary union. Sutures are used in primary union. They are not used in secondary union. Now, in healing process, scanty granulation tissue is formed at the incised gap and along the suture tracts, while in secondary union, exuberant granulation tissue is formed to fill the gap. Now, after healing outcome, in primary union, the neat linear scar is formed, while in secondary union, contracted irregular wound healing will occur, leading to ugly scar formation. Now, complications in primary union, complications are infrequent, but epidermal inclusion cyst may form. In secondary union, suppuration may occur, which require regular debridement. Another important question from exam point of view is factors influencing healing. So factors which influence healing, number one, they are local factors. Local factors are any infection. Infection is the most important factor acting locally which delay the process of healing. Poor blood supply will slows. It will also delay the healing. Foreign body. Any foreign body in the wound, including suture, will interfere with healing. So, debridement is essential. Movement will delay the wound healing. Exposure to ionizing radiation will lead to delay in granulation tissue formation, which will further delay wound healing. Exposure to UV light, it will facilitate the healing. Now coming to the systemic factors affecting the wound healing. First is age. Wound healing is rapid in young individuals, while it's somewhat slow in aged individuals and dilapidated people due to poor blood supply to the injured area. Nutritional deficiency will also delay the wound healing, like protein deficiency, vitamin C deficiency, and zinc deficiency will delay the wound healing. Any systemic infection will also delay the wound healing. Glucocorticoids, they have anti-inflammatory effect, so it will delay wound healing. Uncontrolled diabetic. The patient with uncontrolled diabetes are more prone to develop infections and hence it will delay wound healing. Hematological abnormalities like defect of neutrophil functions, like defect in neutrophilic function like chemotaxis and phagocytosis, and neutropenia, any bleeding disorders that will delay the process of wound healing. Thank you.